Welcome to the Darcy Wellness Series. During our series, we will present information on complementary and alternative medicine and how non-drug and non-surgical options can benefit your wellness and help keep your loved ones healthy. Today, we'll talk about bodywork, massage, and yoga. What is bodywork? How does it differ from massage? And why is yoga so popular? My name is Jeff Darcy. I'm an acupuncturist and herbalist at the Darcy Wellness Clinic. And with me today in the studio is Patrick Crowley, a massage therapist and yoga teacher, also practicing at the Darcy Wellness Clinic. Welcome, Patrick.
Thank you.
So what's the difference between, I hear the term thrown around, bodywork and massage. What's the difference between the two?
Well, massage is a therapeutic technique working with the muscles and tendons, sometimes the ligaments, while bodywork is a more umbrella term for all kind of hands-on therapeutic techniques. So, for instance, shiatsu, craniosacral therapy, which works on the nervous system and is very good for people with back problems, car injuries. Also, kind of stretching techniques, Thai massage, for instance, is often called Thai bodywork.
So there's basically lots of different schools of thought that have evolved or over probably thousands of years, right?
Thousands of years from different traditions.
The Chinese tradition, you got Thai massage. In the West, you have what, Swedish, and other
Swedish
schools.
Deep tissue work is considered under massage. Shiatsu is considered most people use the term bodywork for shiatsu.
Right.
So you will hear shiatsu massage.
Is the Japanese
form of massage.
So what are they working with shiatsu, for instance?
Well, shiatsu works with the acupoints of traditional Chinese medicine and Japanese medicine, and uses them in different ways to relieve stress and also to tonify the points.
Yeah.
Shiatsu includes working on the points and also various massage techniques that, compared to Western massage, use a lot more vibration.
Yeah.
So
lots of different techniques, and most people tend to think of massage as kind of being something lightweight you would pamper yourself with at some spa, but really it's a lot deeper than that, right?
Well, you could say there are two major divisions in massage. Massage for relaxation, which is done in a lot of spas, but at the same time now massage is growing so much that there are a lot of spas where there are very good practitioners who are doing therapeutic work, and they'll make that distinction as well.
Which begs the question, how many massage treatments are there?
Well, from August 2004 to July 2005, 47 million Americans had a massage.
Actually, we were just laughing just because that's a lot of massage. I had no idea it was that popular.
It's incredible.
Some of the figures on complementary and alternative medicine are that 1 in 3 Americans have turned to some form of complementary medicine, whether it be acupuncture, massage, or chiropractic, whatever. So it's really growing at a phenomenal rate.
It's incredible,
and it's probably growing at a rate consistent with the amount of stress that we're putting on ourselves in daily life. So, how well does massage treat stress-related symptoms?
Oh, it's incredible for stress. I mean, people, come into massage very stressed out, usually aches, pains, injuries from various things, often from doing too little. A lot of back problems come from sitting by the computer at work. And massage releases endorphins, it gets the circulation going, it relieves the muscle
So increasing tension. The level of dopamine, beta endorphin, serotonin, all of those are really helping to counterbalance the stress while they're undergoing massage and after, right? So how long would that continue, that benefit continue on after the massage?
It really varies from person to person. I mean, it could, depending on the person. I would say in general, people feel it very strongly for a few days. Sometimes people have amazing results and something is completely cured. Yeah. I mean, somebody came in, I've been working on a lot of frozen shoulders lately.
Yep.
Somebody came in with a frozen shoulder. She's gone to a lot of different kinds of practitioners, doctors as well, who really didn't do much except pain relievers and that sort of thing. And she's really been working on this, and she also does a lot of stretching. She came in for the massage. I worked on her for an hour, and she said she's free. It's still a week later, and she's at a completely new level of...
So how would you explain that? The idea that there are tensions torquing out the structure of the cervical spine leading to the structure of the shoulder. How would you... Why does massage work for, say, a frozen shoulder? Is it just that it's locked in with intense spasms for a long period of time?
Well, the first thing with, I think, a lot of forms of holistic care is the spine. In massage, we work a lot with relieving the tension of the muscles around the spine.
Yeah.
And the back is the organizer for the body. So when we're doing any physical action, our spine is the central focus point. Even when we move our arms, we have to have our spine working correctly. If we have a tension on one side, it's pulling the vertebrae in a certain way, and then we'll have weakness in the arm and how it's functioning.
Right, right.
So these various tensions build up over time. And if people are, most people don't know how to work with their bodies very well, which will bring us into the discussion of yoga and other things that address that. And they'll get an injury. And usually by the time they're really injured, say a frozen shoulder, there's a problem with the shoulder, there's a problem with the spine, they may have an imbalance in the hips and the way the pelvis is sitting.
So when you're able to release some of these muscles and relax some of these muscles in the myofascia, then that stops the spine being torqued out, pressing on nerves, so the body can come back into balance.
Right.
Maybe we should just go to our first slide on massage. So there we go. There's the 47 million massages. That's a lot of massages. And probably a lot of those massages, right, Patrick, are not just for stress-related syndromes, but also more for muscle pain. Any other examples you have as somebody comes in with tight neck muscles causing pain down the arm? Or
Right. Well, a lot of people come in to me and see me for automobile accidents. So they have
like whiplash.
Whiplash, a lot of neck conditions. And there's a kind of work called craniosacral work, which both chiropractors sometimes do, osteopaths, and also massage therapists. And it works with aligning the bones of the skull. A lot of kind of bringing space to these bones, or 22 bones of the skull, and working with the vertebrae a bit. And it's mostly about...
That would have attending effects for headaches or...
Headaches, for the tension. It often, craniosacral work deals with the underlying issues, so that if somebody has vertebrae out of alignment, it'll get some underlying issues. They can go to their chiropractor and get an adjustment there. But often, even that's the thing with holistic health. You have to be, seeking the solution for yourself. And I actually believe this happens in a lot of Western medicine as well. You go to one doctor, they can't do anything. You finally get to the doctor that works for you, or the right diagnosis, or the right prescription, or and it's the same thing. So somebody may go to a chiropractor for whiplash, and it may not work. They come to me for craniosacral work, and it will work.
Good. So let's take a minute and we'll go to the Darcy Wellness Clinic, where Judy Fiataroni, who's a registered nurse and massage therapist, is going to be giving a massage.
Hi, I'm Judy Fiataroni. I'm a registered nurse. I was working in the nursing field for 24 years, and I decided to come into massage therapy a year ago, and I graduated from Bancroft School in massage therapy, and I started here at Darcy's in June. And really, this is a wonderful place to be. There's a lot of different practitioners here, and we all have different things to offer. I do Swedish massage and deep tissue massage, depending on what the client needs. I will do Swedish, or lately I've been doing work on frozen shoulders. post chiropractic work or acupuncture. And there's other elements that massage can help with. And we think surgery or going to the doctor when we have carpal tunnel or plantar fasciitis and things like that. And actually you could try massage therapy, acupuncture first, and see if that might alleviate the problems first. And we have different techniques that we can use for that. So after getting a history on the client and to see what the issues might be, most people have neck problems and low back problems. We seem to get a lot of people, because of gravity pushing on our bodies, we have a lot of that, those kind of issues coming in. So we would start, everyone has a different technique. With the client's permission, if they want, I would start on their scalp, do face, we do all extremities, feet and back, and would concentrate on areas of the body that the person's having problems with. So this gentleman is having low back problems, and so I'll just demonstrate a few different techniques. Are you warm enough and comfortable? Okay. If we're doing deep tissue massage, we don't use oils because you can get into the tissues a little deeper when you don't have oils on the skin. But when we're doing a Swedish massage or anything that you need some glide, we can use oil or lotion. And there's different techniques we use. There's effleurage, which is usually a slow stroke, and that gets the circulation going. Petrissage is a little bit faster. That gets circulation going. This is also a petrissage technique. Russian sawing. You also want to smooth out every time you do anything that's a little bit more strenuous. Are comfortable? Okay. If you get into, if someone who's having shoulder issues, you might do cross fiber friction. That goes across the fibers of the muscle. And we go as light or as deep as the client feels is necessary too, unless we feel there's a problem under the tissue. You can use elbows if you needed to get into an area that's deeper pressure. This is a type of myofascial stroke. Just kind of splits the fibers, and see a little jumping there.
Welcome back. We're with Patrick Crowley, a massage therapist and body worker at the Darcy Wellness Clinic. Patrick, so what does it look like to come and see a massage therapist? Just describe what that process is for somebody who's never considered massage for themselves.
Right. Well, somebody comes in, they make their appointment obviously, and they come into the office, and we usually talk. I have to take a history, and get a sense of what's been going on in their body, different things. If they have injuries, they tell me about them. I ask them a series of questions.
Right.
And
so they don't have to get undressed or anything. They're clothed, or have a robe. They get down, face down on the table, right?
yeah,
The massage
after we do
table.
the intake and we decide what we're generally going to work on, I leave the room.
Yeah.
They get undressed for a massage. Now, we were talking about bodywork. A
Yeah.
lot of the forms of bodywork don't require somebody to get undressed. And,
Right.
and I can do work on the muscles as well as other forms of techniques that don't involve somebody getting undressed. So if that's
Right.
a concern for them, they certainly don't have to do that. But
And
many-
how long is an average massage? I mean, what would you recommend? Is it an hour and a half?
I like to often work in an hour and a half, but it's an hour and a half.
Yeah.
You know, sometimes when people are coming in for other treatments in the Darcy Wellness Clinic, I'll work for a half an hour
Right.
on somebody, and then they'll go off to their chiropractic or
Right. So it's a
acupuncture
great
treatment.
complement to chiropractic, to acupuncture, because a 30-minute massage can set you up really well, release some of the tightnesses and tensions in the myofascia and in the
in
muscles,
the muscular system.
so
yes.
that when the chiropractor makes the adjustment to correct the balance of the spine, it's much more able to go in without the armoring, the physical armoring of the muscle. Yeah.
Exactly.
And true for my practice too as an acupuncturist, after people have seen you there set up really well on the table, for me to be able to balance the energy very well. So it's nice to have somebody in a nice relaxed place for other therapies. So you see a lot of athletes also, right? You're a dancer yourself, I know.
Right.
And so you
Martial
see
artist.
martial artists, so that you've come to know that athletes tend to seek out regular massage therapy.
Right. I think there's something with my training, both as a dancer and a yoga teacher, that I understand how the body is as a functionally moving body.
Yeah.
And so in a way it gives me a North Star to know what to do with somebody, with whatever techniques I'm working with, because
Yep.
I understand how the muscles need to work in order for the body to be moving correctly.
Right.
And in some way that gives me an advantage over many other massage therapists and body workers,
Yep.
because I know what the body's supposed to be able to do. One of the things I wanted to mention with body work is some of the work I do is body work stretching, very similar to Thai massage, but it involves manipulation. So the stretching, in a way, I'm doing very similar to what somebody would do in a yoga class, but I'm doing it to them in a sense.
Right, right. And also, that would be very helpful for somebody who has very limited range of motion. Like if I refer to you a fibromyalgia patient who's very stiff, you would be
Right.
able to do gentle stretching so they wouldn't overdo that stretching by doing it themselves in some sort of yoga
Right.
pose.
A lot of the techniques I do, I mean, some of them are incredibly gentle,
Yeah.
and I can also do very deep work. So
Well,
I really...
Let's take a minute and we'll go to the Darcy Wellness Clinic and actually see you interact with a patient. So we'll take a minute and go there.
I'm Patrick Crowley, a body worker and massage therapist here at Darcy Naturals. And this is Artemis Jukowski, who's been coming to me for many years. And he's going to talk a little bit about his experience.
Well, working with Patrick as a person with chronic pain, I have a neuromuscular disease, has really changed my life dramatically, particularly because pain is such an indicator of something wrong, and Patrick's work is able to teach me about how to manage my pain in a whole different way, and I'm very grateful for what you've done over the years. Patrick is a very special body worker, works mostly in the areas of referred pain, not just the specific areas, and ultimately I feel better working with you.
Thank you.
Welcome back to the Darcy Wellness series. We're here in the studio with Patrick, a massage therapist and body worker. So Patrick, before we move on to our yoga segment, tell us a little bit about how you work.
Well, one thing that I started noticing in massage therapy and body work is I'd have one client who I would do these set of techniques with. There wouldn't be much change. Another person, it would be dramatic.
Yeah.
What was the difference between these two clients? this person knew more about their body. The second person knew more about their body, how to sense their body, how to receive the treatment that I was giving them. So what
like
is
being
this?
able to relax into it more and participate with you.
Participate.
Yeah.
And what does participation look like? Well, one, it's about feeling sensation, just sensing your body, getting into your body, as I sometimes refer to it. Breathing is a very, very important part. And the knowledge that I have from yoga, I bring that into bodywork and see that to teach people how to breathe while I'm working on them
Right.
is amazing, the difference. I'm pressing on a point, they breathe into it, suddenly it just melts.
Yeah.
And, I'm very interested in having clients who want that level. If somebody wants just to completely just be passive, then it doesn't work as well.
Right.
The techniques aren't as effective.
So let's cover yoga now. So what is yoga?
Yoga is a discipline basically of postures and movements that were developed in India, and really the first...
Ancient, 4,000 years ago.
4,000 or 5,000 years
Yeah.
ago. There are various texts about it from, I think the first text is 3,000, 4,000 years ago.
When I was younger, I spent a year in the Oki Yoga Dojo in Japan and saw some remarkable results of using yogic exercises to correct spine imbalance, scoliosis. It was really quite amazing doing yoga every day. You could really feel the body working at an optimum level.
Well, that's the thing. In the East, the whole idea of having some sort of physical practice where you're several times a week, maybe every day, you are doing movements or postures that teach you about your body and keep it young, keep it flowing. In China, the Tai Chi, the martial arts in general in the East.
So it's a great help for longevity, proven over generation after generation. So primarily it's quite big now, very big in the West. Right? We were looking earlier, like 1 in 20 people now are doing yoga. It's going through a large growth right now.
Right.
And
yoga has taken over really as in the 80s was aerobics. Well, today it's yoga.
Yeah. And what do you attribute that to? What do you think is kind of driving that shift?
I think it's the shift where people do want something that's more holistic, something that gets all the various aspects of themselves, not just a mechanical, physical process like lifting weights, but something that involves breath, involves the whole body, involves also some sense of mental, emotional, and spiritual well-being.
Yeah. So, we have, maybe we could show a slide right now of one of our yoga slides, and then we'll go to Patrick giving a class. So, decrease mortality, morbidity, decrease in anxiety and depression, increased cognitive functions, increase endorphins, increased moods. All of this are some of the scientific verification about what yoga does. That's pretty phenomenal. Mm-hmm. If we could just take a minute now and go to Patrick's class at the Darcy Wellness Clinic in Natick.
So in yoga, we really want to take care of our bodies and learn how to take care of our bodies, and that's really the essence of yoga. So let's close our eyes to begin and just feel your spine and vertical. Let the bottom of your pelvis support your spine, the sit bones as they're called, the bottom of the pelvis. Let your head be perched on top of your spine, and bring your hands together, your palms together at the heart, and we'll center to begin class. Let go of your day, let go of your worries, and come into a sense of your breathing. Feeling sensations, feeling the movement of your breath. Okay. And open the eyes. Artificial yoga class. And we'll come up to doing the sun salutations. How much will actually be in the video?
Excuse me?
How much will be in the total? Probably of just
It
a
really
few
depends.
seconds.
I mean, Jeff is going to touch on everything in his show. He's going to touch on every single thing that goes on here. So, and this is one of them, and then he might have it up for a minute or two. But I mean, the more different things I have, I can cut it up and I can show different variations of what you guys do.
So let me just mention one thing before we do the sun salutations. And that is, it's a standing practice that we're going to have with all of the poses of sun salutation. And it's this idea of the small dance. So our feet are in parallel right underneath the hips. And we let our body be like a piece of seaweed at the bottom of the ocean. This sense that we're not actually making this sway happen in the body, but we're not stopping it. In other words, breathing produces movement in the body, and all of the blood pumping in your body produces movement. We're just going to try to relax enough to feel this movement and let our body be moved. Closing your eyes, feeling the small dance. It's the force of gravity, the support of the earth, acting on your body, and all of the joints and bones of your body responding to gravity. It's really an anatomical and evolutionary wonder that we even can stand on our 2 feet. It takes a phenomenal amount of coordination. We're just relaxing our body to feel the small dance, this relationship with gravity and with the support of the earth. You can open your eyes. We're going to keep this quality the whole time that we do the sun salutations. So again, looking at the feet, let's spread through the toes a few times, just letting the toes fan out a number of times, picking them up, fanning them out, laying them on the floor, and bringing the arms together, palms come together at the heart, closing the eyes, centering even distribution of weight through the feet, and opening the eyes. We'll inhale the arms up into an arch through the spine. Exhaling, straight spine brings us down, the arms flying out to the side. Standing forward bend, feeling the small dance and standing forward bend. Breathing, letting your spine relax with gravity, the backs of the legs open. Breath is food for your body. Let your body receive. On the next inhalation, right foot goes back into lunge. Hands are by the feet, flats of the fingers on the floor, palms up. And the toes of the right foot go back, letting the chest open. Small dance. Pushing through the hands, left foot comes back into downward dog. It's like a pyramid. We let the neck and head release. We spread out through the hands. We reach the sit bones of the pelvis back and up. Relax the heels with each breath a little closer to the floor. And knees float down to the floor. Chin, chest comes to the floor, coming forward like a snake. We come into half cobra. The arms and back, fingers interlace, opening the front of the torso. And hands release underneath the shoulders into full cobra. The abdominals support the lower back. We arc through the chest.
Well, thanks for joining us today for our series on wellness. We hope that you've learned some new non-drug and non-surgical options to help keep yourself pain-free and achieve health and wellness. From myself, Jeff Darcy, and Patrick Crowley, massage therapist and yoga teacher at the Darcy Wellness Clinic in Natick, we wish you and your loved ones health and wellness.